Good evening, Council, Mayor, Budget Committee. My name is Cham Hertz, and I am the Human Resources Director here at the City of Springfield. And I'm here this evening to present to you the fiscal year 23 budget presentation for the Human Resources Department. The Human Resources Department is supported by currently eight FTEs. We've historically had 7 FTEs through or since FY20. But had an increase back to 8 FTEs just recently, as early as March 1st of this year. The department services that we provide here at the Human Resources Department follows kind of the traditional areas that Human Resources provide services in the areas of employee and labor relations, classification and compensation, benefits, recruitment, training, leave administration, and then we have the additional area of risk management and payroll, all fall within the support of the 8 current FTEs that we now have within the city department to provide services to our city employees. So we've had a pretty busy year. I think the COVID pandemic has created lots of challenges for several departments within the organization, and certainly in particular in the areas for human resources. But we were really proud of the hard work we were able to do under really unusual and unique circumstances that's kind of carried over the last 2.5 years. Some of the 5 priority areas of accomplishments that we're proud of, one of those is in the area of increasing diversity to the city workforce. I have a few more slides that I'll talk about diversity and why diversity is important, but we did take on some additional changes in the way we've done our processes that resulted in not only positive gains as far as the diversity of our workforce, but also an increase in the talent level within our organization, and something that we're quite proud of. We also, in addition to that, provided and created an incentive program for individuals to get vaccinated. It was really critical and still maintains critical to us during the pandemic that we have a workforce that's healthy and safe, and we created an environment that's healthy and safe. And one of the ways that we did that was through a financial contribution to the employees' HRA benefit contribution, and also making sure that we had systems in place to support employees should they have some sort of adverse effect, or that they had the time off necessary to get the vaccinations that were being offered. The result of the vaccine incentive, or the results of kind of the engagement within our workforce, was that we had a workforce population of 80% that received the vaccine and maintained their vaccination status. So once again, an area that was really critical to our community and something that we're very proud of. And I've got a few more slides that'll talk about the pandemic as it relates to our health insurance, as well as the health of our workforce. The third item was the transition away from CIS as our workers' compensation provider to SAFE. This was done for a couple of reasons. One of them was SAFE was transitioning out of that particular insurance plan, and then the second was really that the cost savings to the organization by going to the much larger SAFE supported organization. I'll have slides, like I said, that will cover some of those items as well. 4 was the implementation of risk management's information system. The area around our liability insurance has received a great deal of attention, primarily with some of the events that have occurred within the police department over the previous years. But even prior to that, trying to create a culture that was, had a risk management system, or enterprise risk, was something that we had been working on for a number of years. And then having a database and a tool for us to manage our claims and liabilities and seek the proper reimbursement was something that was lacking, and something that was a challenge for us to navigate utilizing kind of an Excel or traditional paper-based model. And so this particular database, which has completed its phase 1 rollout, long-term is going to create great dividends for us as an organization, not only in managing claims, but also in the administration and the proper tracking and calculating of claims as they're coming through. And then the 5th item that we had was the background check vendor. This was a critical objective for us. The city, for a number of years, had been utilizing the Springfield Police Department to run the criminal background check. The challenges that we had with that particular model was that under the CJIS rules, the background checks were being performed by the police department. There was an inability to meet the regulatory requirements for providing third-party reporting because they weren't a third-party agency to individuals that may not have passed the background check, and that is a critical requirement in order to be compliant with regulatory rules So we were able to implement this, and then the plus side of that is it's also taken that workload off of our busy police department and allows us to manage it in a way that's efficient for the city, efficient for the community, and also provides additional services that we weren't able to get through the police department's background check process. From a budget perspective and a budget summary, the overall budget for FY23 is remaining flat as compared to FY22. The primary reason that it's staying flat really has to do with the health of our benefit plan and the fact that we had relatively low utilization or lower utilization than we had expected, which is allowing us to take a much more conservative budget approach for our benefit plan, which is up through our insurance fund. So even with a relatively flat budget, we are increasing to the general fund by an amount of $90,000. That additional increase to the general fund has to do with the staffing needs for the department, and then the typical kind of step and grade wage increases that are planned in on an annual basis. I have about 2 slides that I'll spend talking about the need for the FTE and what that resource is going to do and why that's important for the city. So I'll hold off providing additional context at this moment. The second item was there is a 30,000 increase that's built into the larger increase that's going into the insurance fund. That increase is to give us a technology solution that was approved through the budget process to allow us to seek either a database solution or potentially a third-party administrator to help us with our statutory leaves. And then the additional increases that we're seeing is really primarily being driven by the budgetary needs that we have with our liability insurance. Overall, as far as kind of a general highlight for our budget, I would say that our benefit costs were significantly lower. So there was no increased charge that was going to happen to the city for the administration of our medical and life insurance plans. And overall, our city insurance reserve funds remain relatively healthy. And I have 3 or 4 slides near the end of this presentation that I'll go over the 3 insurance funds that we oversee here at the Human Resources Department. Before I get to some of the additional data, I want to talk about the initiatives that the HR department is going to be pursuing for completion over the fiscal year 23. So there's really 4 core items that we're going to call out. There's certainly other items that are in our queue. The first one is the RFP for a vendor or technology solution to administer our statutory leaves. This ties directly to the second item, which is the new Oregon Paid Family Leave Law. Or Paid Family Insurance Fund. That new statutory law is set to have an effect to the city starting in January when it comes to the payroll deduction requirement, which is a 1% payroll tax that helps fund the paid leave, with the actual paid leave taking effect later that year around June or July. So those are the 2 core items that we have to do. There is no alternative for that. We have to come up with a way to be compliant with the regulatory rules for the paid leave, excuse me. And then on top of that, we have to figure out a way to not only administer that, but administer all of the additional leaves that come through the Human Resources Department that requires protections for employees. And to give you kind of a general example of what I'm talking about, we're talking about Oregon Family Leave Act, the Family Medical Leave Act, the Americans with Disabilities Act when it requires protected time off, workers' compensation leave, Oregon Paid Family Leave, the Oregon Sick Leave, the Crime Victims Leave, Domestic Violence Leave, Pregnancy Disability Leave, and Child Bonding Leave. And there's probably a few others that I'm missing. So it's a very complicated series of rules and regulatory requirements that provide necessary protections for our employees. And it's really critical and legally important that we do that in a way that the law is spelled out and ensures the right protections and support for our staff members in those times of need. The third item is the extension of the Origami product. So we have started the rollout for our risk management information system, primarily dealing with claims with a focus in our operational areas. As that continues to roll out, our third item that we want to accomplish there is really the full larger enterprise risk management module, which will tie and provide additional resources and support structure for the city's initiative around enterprise risk. And then last, and certainly not least, I'll talk more about this in a couple of slides, and I said it earlier, is the continued work that we need to do around diversity and inclusion within our organization. So I'm going to start with diversity. So diversity is critical to our organization, not from the perspective of just thinking about it from a data point, but really critical from a perspective of trying to ensure that we are the employer of choice, that we have a organization that people want to work at and stay with us. And I don't think there's any better indication of your cultural health than a cultural health that talks about the belongingness of an organization. And the data that you're seeing up here is really just kind of a historical data point that dates back to 2003. I actually have records that date back into, I think, the early 70s. And we've really had a pretty slow increase in diversity as it relates to a reflection of the community that we serve. The slide indicates an area that the rough census that was completed in 2020 that indicates our population is really 14.8 or right around 15% non-white. And you'll see from our data point, we've historically hovered around the 9%, at least since 2018, and less prior to that. And we made some gains this year, increasing it up. And so we really have a target objective, and it's now a measure within our budget pages of really focusing on our efforts to make sure that our workforce population better reflects the community and better reflects kind of a welcoming place to work. Similar with gender, we've basically hovered around the 35%. Some of the primary reasons why it's hovered at 35% and not something greater has to do with the number of primarily what is considered male dominant industries. All of those areas have taken considerable effort to expand the gender of their workforce. So we're talking about police, fire, and our operations crew. And we're hoping that all of those initiatives will continue to see us as a more diverse, welcoming place to work. This is another slide, just kind of shows this, the other chart that I just presented in kind of the Pac-Man model. And it really breaks out the ethnicity of our workforce in a little bit more detail. And what it really shows within this area is that the Latinx continues to be the area that is not fully represented within our community, and certainly a population of our community that we need to reach out and continue to see this as a place that is a desired place to work for everybody. So looking at diversity and thinking about the challenges that we have in recruitment, the reason that the city manager, or one of the reasons that the city manager had really asked for the Human Resources Department to increase its internal staffing was in large part to really just support the recruiting needs that we have within our organization. At present, we have one FTE who is dealing with a series of really complicated positions, trying to fill the needs of the organization. And what we're seeing is an increased number in demand on her workload. When I first started, we had about 1.5, a little bit more than 1.5 FTE dedicated to recruitment, and we were doing 46 annual postings a year. Today, we have a single recruiter and filling an average of 56, if not more, job postings. And what this chart has got a couple different grids on it. So the bottom chart is just kind of reflecting the unemployment rate. And we're faced with a time where we have an unusually high number of positions and a really difficult limited marketplace that we're trying to recruit for, which creates a host of challenges. And then in the upper right-hand corner of this slide, you're seeing our turnover rate. And so while the city has not added a significant number of new positions in the organization, at least since 2015, we have seen a dramatic increase in the amount of turnovers that we've had during the pandemic. And the turnover is in part due to retirees separating the organization. So the average retiree percentage of our turnover increased from roughly just below or right around 2.5%, has now increased up and around 5+% over the last 2 years. Some of that was known. We certainly knew with the baby boomer retirement bubble kind of bursting that we were going to see an increase in retirees, and then that in fact is true. What we didn't expect was what has been coined as the great resignation as part of the pandemic. And so we're seeing a significant change in the wants and needs of those people that are seeking work, driven in large part by kind of the realities and challenges that was hit in the workforce population with the pandemic. So we're of course talking about schooling and whether or not homeschooling is better than going into public school. We're also dealing with just different custodial needs of individuals, and then where the competitive landscape has changed pretty dramatically is the increase and kind of what's going to be expected long term with telework as being much more of a regular player as a workplace option for individuals, and the percentage of our workforce that prefers to have that telework flexibility option versus in a traditional cube in office. So this is creating a very different landscape for us. And on top of that, we've got a very high inflation rate, and we're seeing the public side, we're seeing the private sector make dramatic changes in primarily wages and benefits for employees. And they're doing that at a clip that is far greater and faster than what the public sector is able to do, either because of budgetary constraints or because of labor contract negotiations in the percentage of our workforce that's represented under a collective bargaining agreement. So a dramatic change in what things have looked in the past, and a real challenge with public sector to move in a pace that we're seeing out on the private place, all creating challenges in the recruitment area and challenges for us to be able to not only recruit but retain top talent within our organization. And there just isn't a quick solution for how we're going to be able to do that. And what the consequence to the organization has been is that we've had positions that have been posted 2, 3, or 4 times and still not able to fill the position, and putting us in a spot where we're looking at creative ways to get people the skill sets necessary to fill these hard to fill positions, where we've traditionally been able to recruit experienced individuals in our community come and work in our organization for those roles. So it's a really dynamic challenge. We're seeing that in a lot of our hard to fill positions, and then also it's being blown up even more in our public safety workforce. The other reason for needing an FTE, so the intent of the new FTE was to create a full-time additional resource to support the more transactional part of the recruiting and onboarding experience for our new hires. So have somebody who's focused in on getting the word out about the jobs to screen applicants, and then once an offer has been made, be able to hand that off to an administrative role who can then support kind of that experience for that person from the point of offer acceptance all the way to when they come on board in new hire orientation. In doing so, the role that position previously filled, which included some recruitment support, but also included most of our administrative transactional work, was more than a full-time job. And so by adding an FTE and administrative support for recruitment, we were then able to use the existing position in a way that was different than what we've done it in the past. So still available to support the personnel file, the record keeping, the the finance part of making sure we're meeting our budgetary needs. But in addition to that, provide that extra resource support or capacity that was into that position, provide the resources and support that we need to help us with some of the elements that are more transactional with the statutory leave requirements, but also in benefit support. The big challenge for us on the leave administration, not that we didn't have a challenge before, but what's really coming up to us is this Oregon paid family leave. There isn't a lot of templates for us to know what to expect in the state of Oregon other than what we're seeing in the state of Washington. And what we know from that is that it's difficult to administer. It's going to be a hard rollout, and we're trying our best to kind of set ourselves up in a way that we can support the employee, but also support the administrative reporting requirements that are attached to this. And if you don't know a lot about the Oregon paid family leave law, what it essentially does is it provides up to 16 weeks, 12 of which are compensated under this insurance plan administered by the employment department, unless the employer wants to have a standalone plan that is equivalent to what the state plan is. So we've got this core decision making of, do we follow the state plan? And there's certainly a lot of push and incentives they're trying to put out for the employers to follow the state insurance plan, obviously to keep it funded properly, or do the alternative, which is to have our own plan, which might be financially beneficial to us as an employer, but creates additional administrative burdens and what I would call soft costs that we weren't expected. And so we're still in the decision-making model, and we're still waiting for the final rules to get rolled out, which are anticipated to be rolled out in early September, with the plan taking effect in January. And the plan pulls basically a 1% payroll tax from an employer to fund this. That payroll tax can be funded in part by the employee or in part by the employer. So it's a 60-40 mix. This item, of course, was written in a way that leaves that up to negotiations. And so labor unions have the right to bargain the effects and the impact of this new law. And some of those effects and impacts include the cost of the insurance plan. So we are still waiting to hear from our labor unions regarding bargaining of this, but we anticipate that that will start happening in the back half of this calendar year. So a couple of reserve fund updates. There are 3 core reserve funds that the Human Resources Department oversees. The first of those is the self-funded medical reserve fund. This fund continues to be very healthy. What you're seeing on this slide in the shadowed area is the reserve funds. And the blue dotted line across the bottom there is intended to reflect kind of the bare minimum or the comfort zone that we have with where those reserve funds would be, which is roughly around 3 million. The pandemic for us had a really positive effect on our reserve fund, which wasn't specifically what we were targeting and trying to achieve. So we've held benefits, insurance costs flat really for the last 9 years. And then what we didn't anticipate with the pandemic was that we would see a 2-year decline in cost, meaning what we were anticipating to be costs or projected to see as far as cost increases to our medical utilization actually declined for the last 2 years. And which is great because that means our employees are healthy and are maintaining good wellness, which is a critical part of our plan. And so what we're trying to do now is with this kind of savings is we want to continue to promote well-being and well health within our organization. So the plan itself, what we're budgeting for the year is we're anticipating, well, we are realizing a 2% increase in our administrative costs, but we're also recognizing and predicting an 11.8% decrease to our medical RX or prescriptions and vision claims for calendar year 22. And then dental claims are also seeing a 1.5% increase in administrative costs. And that's the third-party administrator that we utilize to manage the claims in their own. We are targeting a couple more what we call benefit holidays here, where we don't draw deductions from the employer and we don't draw deductions from employees. And those deductions that we don't draw from the employer gets rolled into a per side account to help us with some of the additional costs that we're expecting for PERS. So we'll continue to work on driving the reserve dollars down, but hopefully doing that in a way that's not related to expensive medical needs for our employees, but maintaining a reserve fund that provides that buffer should there be that need. But kind of the long story on this is that our medical plan design has been very stable. It is highly unusual. And in fact, our party administrator can't think of another agency that individual works with where they have not had a rate increase for 9 years. So we continue to manage that. We do budget a very conservative budget to make sure that we're within the legal limit for any anticipated expenses that we have in the year. So that's why that's staying. And I do anticipate, given the kind of the 2-year decline, that we will see an incline in utilization for FY23. That seems to be kind of following the general pattern that you see with our bar chart up here. As I mentioned earlier, the interesting piece with the pandemic was that it didn't result in increased medical costs. And another area where we were really kind of a standout within agencies within Pacific Source was the fact that we didn't experience any hospitalization as a result of the pandemic. So we were very fortunate. Some of that has to do with a pretty high vaccination rate. We would venture to guess when we look at our total members. So when I talk about members, I'm talking about employees and dependents. We believe our total dependents, you see that 726, which we know is low because Pacific Source wasn't able to get all of the data. So we anticipate that our members as a whole are probably around 70+ % vaccination, and that was certainly helpful for us. So it's a combination of doing the right things, making sure we're doing the right precautions, keeping our workforce safe, and vaccinations that allowed us to get through at least this stage of the pandemic in a way that was safe for not only our family members, but not only our employees, but their loved ones as well. And so certainly a sigh of relief on our part as we certainly know and have peers that have not had the same experience as we've had here at the city of Springfield. Property and liability insurance. This is an area I anticipate further conversations from the budget committee when you convene, but an area that we are budgeting more dollars for as a result of what our claims have looked like and what our current insurance plan is set up. What I would say, kind of the knock on wood, is that we have been very good over the last 6 months since we've had the changes within our organization and the change in our plan design. So we remain hopeful that we won't have any high claims, but you just never know. And we're trying to target a reserve dollars that will help us meet that should that happen in the unexpected, and hopefully it doesn't happen, but we're certainly trying to set ourselves up in a way that we're doing that properly. And then the last one is the workers' compensation reserve. This is an area where we're going to intentionally draw down the reserves. We have transitioned the way our plan is set up from CIS which to SAFE, which is a transition to a guaranteed cost plan. And so the number of dollars that we need in our reserve fund will slowly decrease significantly as we resolve the existing claims that we have under the CIS, or claims that were occurring under the CIS insurance plan. And we anticipate that'll take about 3 to 5 years. Once those claims close out, we anticipate that the city will see somewhere around a $200,000 to $300,000 a year savings with the transition to SAFE. As we look at the outlying years and the overarching strategic plan within the HR department, there's really 5 core items that we're going to keep our focus on. These are the same items that we've maintained over the last 3 years and are still critical for us. Benefit cost control continues to be highly important to us because of the overall budgetary expense of around $12 million a year. Really critical that we maintain and do things to control the benefit costs. Our plan design continues to work, but rules change, regulations change. And so we continue to focus and make sure we're putting the right things. One of the items that we're looking at is expanding the Know Your Numbers current campaign, which is really a simple blood sugar BMI test, to something that's a little bit more close to a annual physical. We're still working with the clinic to figure out what they would recommend, but we're looking at expanding that in a way to focus a lot more on preventative care instead of reactionary care. Turnover and recruitment, I've provided some slides earlier that gives you a clear indication of why that's important. We'll continue to do what we can with the challenges that we have and the budgetary restrictions that we have to ensure we have a diverse, welcoming place to work, and that we're a place that is a destination of choice for employees. But it's going to be an ongoing challenge for us, and we're going to have to think about creative ways to help people get the skill set within our workforce to transition or succession plan, whether that's in a leadership position or a hard to fill position. Third is property and liability insurance. We're doing the right things, but we have high risk jobs and high profile jobs at the city. And so the ongoing work within the enterprise risk management program to evaluate our policies and protocols when we have a bad outcome, to take lessons learned so that we reduce or minimize the likelihood of that happening in the future. And then one that really is out there that I haven't spent a lot of time talking about has to do with internet security, cyber security, and making sure we've got the right protocols and systems in place, as that continues to be an area of risk for organizations. We've seen other cities and municipalities get into cyber situations where they were locked out of their systems. And so we'll continue to focus on that. technology support, trying to weigh the positives of kind of the plus minuses of whether or not you host a technology tool in-house in the cost that it takes for the city to administer and manage an enterprise risk system here versus a cloud solution. And so looking at what we need to do in order to provide the resources and technology to support the large list of regulatory requirements and reported requirements will be an ongoing challenge for us. And then lastly is training. I don't think you can administer and reduce your likelihood of high risk outcomes if you don't have a solid training and development program within your organization, nor do I think you can create the opportunities for succession planning within your organization if you don't have the training and resources to help people get the skill set necessary to do that work, because the kinds of schools and universities that provide the specific skill set that we need becomes more and more limited as time goes on. And so creative ways through distance learning and employee development programs will be, in my mind, a key item for us to make sure we've got the particular skills necessary to provide the services to our community in a way that's sustainable and ensures the best efficiency and experiences for those individuals. So with that, I will conclude my presentation. I'll be available during the budget presentations for questions. I thank you for your time of listening to my presentation, and I look forward to hearing any questions that you might have. So thank you.